Hi, this is Lily from the Public Health Youth Association of Canada. This month we'll be talking about COVID-19 and diabetes. Both of these are big health issues that have had a major impact on public health all over the world, and we're going to be exploring the relationship between COVID-19 and diabetes and how they've affected each other, and as well as the health inequities associated with both of these health issues and just how individuals with diabetes can adapt to the current climate. So this is just an overview of the topics that we'll be going over in this video. So starting off with statistics, health inequities, impact of COVID, and how to adapt. So let's start off with some COVID-19 and diabetes statistics. So studies have shown that diabetes type 1 and type 2 are one of the major comorbidities associated with the development of severe COVID-19 related adverse outcomes and mortality. Conversely, COVID-19 has also had a devastating effect on the population with diabetes. People with diabetes are 65% more likely to die of COVID-19. The odds of in-hospital death from COVID-19 is 2.85 times higher in adults living with diabetes compared to patients without diabetes. And people with uncontrolled hyperglycemia had longer length of stay in the hospital and higher mortality compared with people without diabetes or uncontrolled hyperglycemia. So now that we know some statistics about these two health issues, we're going to move into talking about the health inequities with COVID-19 and diabetes. So there are some common factors of developing diabetes and adverse COVID-19 outcomes, and that includes metabolic factors such as obesity, being of non-white ethnicity, and being of poor socioeconomic status. So, as we know, insulin is the preferred treatment for diabetes. However, the impact of the pandemic on the global economy has compromised insulin production and access. And for people who are insulin dependent, the risk of an insulin shortage or delayed delivery is deadly. So health professionals are recommending people to have a 30-day supply of diabetes medication and supplies for their medical devices during the pandemic. However, this advice may be difficult to follow as people in both urban and rural settings who experience socioeconomic disparities, specifically lower income, may not be able to afford adhering to these guidelines. And there's been significant decreases in in-person clinic availabilities, and so this has required people to switch to receiving digital diabetes care. And although it is a great alternative to visiting a healthcare facility in person, especially during the pandemic, digital care is not a luxury that every citizen can afford. So let's talk about the impact of COVID-19 and how it's affected diabetes. So healthcare services has been disrupted by COVID-19, and evidence from other national emergencies have shown that such disruptions can lead to worse diabetes outcomes during and after these events. It has adverse indirect effects on detection, prevalence, and management of diabetes and other conditions, worsening or improving health behaviors, and self-management. And so the pandemic has shifted the focus away from primary care, causing a disruption of care for people living with diabetes and other chronic conditions. The measures put in place by governments, while necessary for infection control, have actually led to unintended effects such as interruption in diabetes cares, which includes that regular patient-provider interaction for patient education, medication reviews and renewals, prevention, screening, and management of complications, and mental health assessments and interventions. So there's been reduced access to necessary medicines, either due to the lockdown or financial hardship, and this pushed people to ration their insulin and or skip oral medications. And physical distancing measures have increased unhealthy dietary patterns and mental health related concerns, as well as decreased physical activity. And the pandemic and social isolation are likely to increase rates of anxiety and depression, which all leads to poor adherence of medications and worsening of risk factor control. So we're going to be looking into ways that individuals with diabetes can adapt during this pandemic. So adapting to the new normal, first of all, it's really important to follow CDC COVID-19 guidelines. People with diabetes have to be even more attentive than others to self-protective actions, including hand washing and physical distancing. Visiting stores in early hours and avoiding peak times when shopping for their medications is also a really good tip. According to the American Diabetes Association, more than 1/4 of survey recipients with diabetes reported disrupted access to healthy food during the pandemic. And with gyms closed and many sports activities postponed, it can be a challenge for diabetic individuals to stay on the healthy regimen. So it's important to fit in at least 30 minutes of physical activity daily and important to eat healthy. Telemedicine. So it's essential to continue to use new methods of care such as telemedicine, which has been shown to have sustainable and long-lasting benefits for people with type 1 diabetes, especially children whose families are experiencing economic hardships related to the pandemic. And virtual visits open up a great opportunity to provide more timely access to not only physician care, but services that are often scarce for those living with diabetes. And last but not least, asking for support. There was a study that was published in October 2018 in Diabetes Care that suggested people with type 2 diabetes who participate in peer support programs are able to better manage depression and their blood sugar than those who don't. And so these results may actually lower overall healthcare costs, researchers say. So that brings us to our conclusion. So I just want to go over some of the points that we did touch upon in this video. Diabetes type 1 and type 2 are one of the major comorbidities associated with the development of COVID-19 outcomes and mortality. Diabetes and COVID-19 has a significant effect on populations that are already affected by health inequality. And the measures put in place by governments, although it's necessary for infection control, has actually led to unintended effects such as interruptions in diabetes care. And so some things that individuals with diabetes can do to adapt to the current climate is follow CDC COVID-19 guidelines, maintain a healthy diet and exercise routine, utilize telemedicine if available as a diabetes management tool, and asking for support. And so that brings us to the end of our video. Thank you so much for learning about COVID-19 and diabetes during the pandemic. We hope you learned a lot more about this topic. Thank you.